Should you stick with original Medicare or enroll in a Medicare Advantage Part C plan? It's a big decision, so let's get started. Andy Stamus here with Medicare Mindset. Today's topic is what we spend the most time on with our clients: how to choose between original Medicare and Medicare Advantage. Let's get into some of the similarities and differences, as well as which option might be more appropriate for you. First, here's the big picture. The assumption is that you're already enrolled in Medicare Part A and Part B with the government. Part A and Part B is the core coverage provided through Medicare, and then all the other parts are obtained through insurance carriers. On the original Medicare side, you have the option of purchasing a Medicare supplement, also known as a Medigap plan, with an insurance carrier. After Medicare approves a medical service and pays its part, the Medigap plan can then pay as well. So that means if Medicare doesn't approve the service, then the Medigap plan doesn't have to pay either. Also with the original Medicare side, you can purchase a standalone Part D prescription drug plan with an insurance carrier. This covers prescription drugs purchased at a pharmacy or via mail order. If you don't purchase a Part D plan when initially eligible, you may accumulate a lifetime late enrollment penalty. On the other side, you have Medicare Advantage, also known as Part C. Medicare Advantage can combine Part A, Part B, and Part D in one plan. There are some versions available that don't include Part D drugs, for example if you have drug coverage through the VA, but many Medicare beneficiaries accept the built-in Part D drug benefits because it's included with no additional premium. These Medicare Advantage plans are like a PPO or HMO, meaning they usually have a network of providers to access. So it's important to confirm if your medical providers are in network with any Medicare Advantage plan you're considering. With Medicare Advantage, you don't use your Medicare card. Instead, you use the Medicare Advantage plan for Part A hospital, Part B outpatient, and Part D drug services. The Medicare Advantage plan is required to allow the same services as original Medicare, and in many cases they offer additional benefits not covered by Medicare. For example, dental, vision, hearing, over-the-counter, and even fitness benefits. Stay tuned for more on that later. Now let's transition to some of the similarities and differences of these two options. First up, the similarities. Premiums paid to Medicare. No matter what you do, if you enroll in Medicare Part B, you'll pay a premium directly to Medicare. It's based on your income from 2 tax years ago. If you're receiving Social Security benefits, the premium will be drafted from your benefits automatically on a monthly basis. If you're not receiving Social Security benefits, you'll be billed quarterly by Medicare. Covered medical services. Medicare has a set list of covered allowed services. Medicare Advantage plans are required to cover and allow those same services. However, Medicare Advantage plans might use prior authorization for certain services to manage care. Drug costs are separate from medical costs. When you're on Medicare with supplemental coverage, you'll have 2 buckets of coverage: medical and prescription drugs. These two operate independent of each other, and that's even true in a Medicare Advantage plan that includes all Medicare parts in one plan. So when we talk about medical costs moving forward, that's truly for medical costs only. Your prescription drug costs are always separate when on Medicare. Those are the 3 main similarities. Now we can get into how you differentiate between original Medicare and Medicare Advantage. We will address 9 key differences. Access to medical providers is first. With original Medicare, you have access to any medical provider in the U.S. who accepts Medicare. If the provider accepts your Medicare, they also have to accept your Medigap plan with any insurance carrier. With Medicare Advantage, you have access to a list of providers within the plan's network, usually a PPO or HMO network. If you're in a PPO plan, you have access to both in-network and out-of-network providers. If you're in an HMO plan, you have access to only in-network providers except in an emergency. Now, how do you file medical and drug claims? Well, in either case, you're not really filing the claim. You're simply providing the appropriate insurance ID card to the medical provider or pharmacy. With Original Medicare, you use your red, white, and blue Medicare card as primary, your Medigap as a supplemental plan, and the Part D plan for medications. So you'll have 3 cards. With Medicare Advantage, you put your Medicare card away and simply use your Medicare Advantage ID card for all Part A, Part B, and Part D claims. The number of ID cards in your wallet shouldn't be a deciding factor, but it's an important item to note. Monthly insurance premiums are next. With Original Medicare in general, when you combine your Medicare Part B premium, your Medigap plan premium, and your Part D plan premium, usually you will have higher overall premiums compared to Medicare Advantage. With Medicare Advantage, when you combine your Medicare Part B premium and Medicare Advantage plan premium, it usually amounts to less than the Original Medicare side. Your out-of-pocket medical cost exposure is especially important. We always need to know, what's our worst case for catastrophic medical expenses? With Original Medicare, it really depends on your plan choice, but overall, your expected medical expenses are typically lower regardless of your health. The costs are pretty defined. With Medicare Advantage, it's very much dependent on your health and utilization of medical services. If you're in good health, you'll pay for things as they occur and not accumulate significant costs. But if you're in poor health, you could rack up a lot of medical costs. Thankfully, a Medicare Advantage plan has a medical maximum out-of-pocket limit to protect you from paying more than a certain amount of medical costs in a calendar year. Dental services. With Original Medicare, Medicare does not cover most dental services. No teeth cleanings, x-rays, crowns, or fillings. Medicare will only cover very rare situations, such as emergency dental when admitted to a hospital. With Medicare Advantage, some plans will include built-in preventive dental services or possibly comprehensive dental. Vision. With Original Medicare, Medicare does not cover preventive vision such as routine eye exams and eyeglasses. However, Medicare does cover medical issues with your eyes, like cataracts and glaucoma. With Medicare Advantage, some plans will include built-in preventive vision services and eyeglasses. And just like Original Medicare, medical issues with your eyes are covered like normal. Hearing. With Original Medicare, Medicare does not cover routine hearing services or hearing aids. But Medicare may pay for diagnostic hearing and balance exams in the event it's to determine whether medical treatment is needed. With Medicare Advantage, some plans may include built-in hearing services, such as routine hearing exams and hearing aid discounts or allowances. Now, what about additional benefits beyond dental, vision, and hearing? With Original Medicare, since there's a set list of Medicare-approved services, no additional coverage is offered. But Medicare is always looking for ways to improve the core services offered, so you may see some changes to this in the future. With Medicare Advantage, some plans include a fitness program, over-the-counter benefits, transportation, and possibly more. The final difference is very important: your ability to switch plans. With Original Medicare, there are 3 different plan switch scenarios. When you initially buy a Medigap plan at age 65, or within 6 months of your Part B start date, it's guaranteed issue, no health questions involved. But if you change to another Medigap plan in the future, which you can do any time of year, medical history questions are normally required. If you need to change your Part D plan, you can do so once per year during the annual election period, or AEP, which spans October 15th to December 7th. If you decide to leave Original Medicare and switch completely over to Medicare Advantage, you can also do this during AEP in the fall. With Medicare Advantage, there are 2 scenarios to point out. If you need to change your Medicare Advantage plan, you can do so once per year during AEP. If you switch back over to Original Medicare, in most cases you'll need to answer medical history questions when purchasing a Medigap plan. But you can easily get a Part D plan during AEP, no health questions there. If you got confused reviewing the previous information, try watching again, but this time reference our Parts of Medicare page located on our website at MedicareMindset.com. Having this visual description close by is a helpful way to see the big picture. Now let's wrap up why you would choose Original Medicare over Medicare Advantage, or Medicare Advantage over Original Medicare. Here are 4 reasons why you might prefer Original Medicare. Number 1, you don't like the idea of being limited to a network of medical providers and want the flexibility to see any medical provider in the U.S. who accepts Medicare. Number 2, you can afford the usually higher premiums associated with the inclusion of a Medigap plan and a standalone Part D plan. Number 3, you would rather pay fixed monthly premiums with minimal out-of-pocket medical cost exposure on the back end. Number 4, you're a moderate to high utilizer of medical services. In this scenario, you would receive a lot of value from your Medigap plan as a supplement to Original Medicare, keeping your medical costs to a minimum. Now here are 4 reasons why you might prefer Medicare Advantage. Number 1, you intend to use only providers within the plan's PPO or HMO network and don't need nationwide access. Number 2, you want to keep your monthly insurance premiums to a minimum and/or you can't afford the higher premiums associated with the Original Medicare route. Number 3, you're okay with paying copays or coinsurance for medical services as they pop up, knowing you won't have to pay more than the plan's medical maximum out-of-pocket limit. Number 4, you find the additional benefits in Medicare Advantage plans appealing, such as dental, vision, hearing, and more. We've covered a lot here, so take the time to review the information and let it sink in. Jot down some questions and contact us for help. And reference our other videos to put all the pieces together.